For this health assessment video, we will be assessing the gastrointestinal tract. First, you want to let your patient know what this entails. Let them know that you'll have to expose them a little bit by looking at their abdomen. Let them know the areas that you'll have to touch and palpate and all that. Next, it's important to get a health history just to understand what's been going on with the gastrointestinal tract. You would do this with any body system, see if they've had any difficulties, anything like that. So we will start with the upper abdominal. Have you had any abdominal pain recently?
No.
Have you been experiencing heartburn at all?
I do occasionally after I eat spicy foods.
You said spicy foods. Does any other foods cause heartburn for you?
When I eat like tomato-based foods.
And is this normally just a burning sensation, or how does it feel?
Yeah, it's a burning sensation.
And is there any relieving factors that help it go away or disappear?
I use like Tums just over the counter.
Have you experienced any nausea or vomiting?
No.
Any dyspepsia in your upper abdominal area, anything of that nature?
No.
Any lower abdominal pain?
No.
Have you had any dysphagia or difficulty swallowing?
No.
What about any painful swallowing?
No.
Have you had any changes in your bowel function? Any diarrhea, constipation, anything of that nature?
No, I normally have a bowel movement every day.
So you're pretty regular. No excessive gas?
No.
Any unusual colors in your stool? Do they look greasy? Or
no, they're normally just formed and soft and brown.
Have you noticed any changes in your skin, such as like a yellow tone? We would call this jaundice.
No.
Okay. And so now we will begin our actual abdominal assessment. We will start the assessment by just inspecting. For an abdominal assessment, you do it in a different order than what you normally would. You inspect, auscultate, percuss, and palpate. You want to auscultate before you percuss or you palpate because you don't want to stir up any noises within the organs or anything of that nature. So we will start with inspection. We will just take a look at her skin, see if the coloring looks okay. Is it warm? Is it dry? Is there any scars anywhere on the abdominal area? Any striae or stretch marks? They could be from pregnancy or from weight gain or weight loss, which I don't see any. Is there any lesions anywhere? No, they look normal. We do have a nevy right here, but other than that, is there any veins exposed or anything of that nature? You want to take a look at her umbilical area. Is it look inflamed? And hers looks normal for the most part. Then you will take a look at the contour of her abdomen. Does it look distended, rotund? Is it flat? And hers is just flat, which is normal. You want to take a look for any ascites, which can be some abdominal distension. Does it look like she has a distended bladder? Maybe she needs to go to the bathroom. Is she pregnant? Which she obviously isn't. Check and see if it's symmetrical. Does it look the same on both sides? Hers looks fairly symmetrical. Look to see if you notice any peristaltic waves, which can be indicative of like an intestinal obstruction or something of that nature. You also want to look up here and see if you see any pulsations, which could indicate a triple A or an aortic aneurysm. For some thinner people, you may see a little pulsation, and that's normal, but for the most part, that should not be present. Next, we will go on to our auscultation part. So you'll need your stethoscope for this, and you'll simply listen to all 4 quadrants for bowel sounds. And she has active bowel sounds in all 4 quadrants. If you weren't hearing any bowel sounds, you would need to listen for 5 minutes in each quadrant just to ensure that you truly aren't hearing anything. If you hear hyperactive, that could be indicative of like diarrhea, something of that nature. And then hypoactive, the individual could be constipated. Maybe they haven't had a bowel movement in a few days. Maybe they have an obstruction, something of that nature. You also want to listen over her her aortic area, just to listen for any bruise or anything of that nature. And I do not hear anything. Next, we will go on to the percussion portion. You just want to percuss over each of the quadrants. Be mindful of the sounds you're hearing. You should hear a tympany sound over the gassy areas of like the stomach, and then there should be a dullness over the liver. Dullness over other areas could indicate a mass of some sort, but it mainly should be over that liver because that's a solid organ. Then you will go on to your palpation part. You'll start out with light palpation, just around her quadrants. See if she has any guarding, if there's any tenderness. Any guarding or tenderness, especially in the right lower quadrant, could be indicative of appendicitis. But she seems fine, no guarding, no tenderness, anything like that. You just want to palpate any superficial organs that you can feel, and just mainly look for any tenderness. Then you will go on to a deep palpation, which you will press 5 to 8 centimeters down. This is to feel the deeper organs like the liver. You also want to look, if you feel, you just want to note the location, the size. This could also help you find any type of abdominal masses. And for those also, you just want to note location, size, how they feel, if they're tender, anything of that nature. And that is basically all for the actual assessment part of it. You then want to discuss with the individual some health promotion activities. And an important aspect for the gastrointestinal tract would be about colon cancer. It is the 3rd most common cancer in both men and women. And while it normally doesn't occur until 65 to 75 years old, it's never too early to start those promotional activities to help prevent this from occurring at all. Some risk factors that an individual can have towards getting colon cancer would be if they smoke, if they have a high-fat diet and like red meats, processed meats, stuff of that nature. If they have an individual in their family who has had a history of colon cancer, or if they personally have had polyps removed from their colon, those are all risk factors for getting it at a later age. It's also some non-modifiable risk factors include being a male, being African American. Some important things to help prevent colon cancer would be obviously the screening test. You can have occult blood test to see if you are losing any blood in your stool, which could be from polyps, or you can have your colonoscopy, which is basically just a tube that goes up through your rectum and into your colon, has a camera on it, and it looks for any polyps or anything of that nature. And then polyps can even be removed or biopsied from that. It's also important to stop smoking, avoid alcohol, and make those diet changes necessary. Eat more fruits and vegetables, avoid those high-fat red meats. Another you can also take NSAIDs. They can help somehow prevent from developing colon cancer. And with any health assessment, it is important to have good communication with your patient. That helps things flow easier. It just overall helps the assessment. So some communication techniques for any individual would be active listening. Maybe nod your head, say yes every now and then to let the patient know that you are listening and you're paying attention to what they're saying. You can do guided questioning, which is kind of what we did with the heartburn. We asked her what caused the heartburn, if any relieving factors, how it felt. We just kind of guided her in the direction that we want it to go. You can try nonverbal communication, which is like maybe a simple touch on the shoulder, anything of that nature. But you want to ensure that the patient is comfortable with that before you proceed with that. You also want to have empathetic responses to anything that they may discuss with you. Let them know that you care and that you're there to help them. You want to validate any concerns that they may have. Let them know that you think they're real and that you're there to help. Give them reassurance and summarize anything that you've discussed. Hit the high points so that they can catch those. And you also want to make smooth transitions from one body system to another. This would be important when you're doing a head-to-toe assessment. Just smoothly transition throughout. And then lastly, you want to empower the patient by giving them health promotion and things of that nature to ensure that they stay as healthy as they can.